What I'd like to do today is really talk to you about how child welfare can benefit from interoperability and real-time decision-making. The Field Center is a collaboration of University of Pennsylvania's schools of social policy and practice, law school, medical school, and the Children's Hospital of Philadelphia. And as our speaker said this morning, it's very difficult to bridge silos within a university system. And Penn has been really very forward-thinking in looking at interdisciplinary learning and interdisciplinary work. The Field Center was formed starting in 1999 to look at reforming the child welfare system. We are privileged to have some of the foremost experts in child welfare all at Penn, in all of these different disciplines, and they all felt if they could get together, what an impact we could make. So what we did is we really looked at what could we do regarding all of these deaths of children. As Daniel mentioned before, city after city, headline after headline, children continue to die who are known to the child welfare system. What is it that could happen to make that different? We know that there's no one easy answer, but one of the things that was pretty consistent that we looked at was perhaps if there was technology available in child welfare, maybe that could make a difference. We were driven by frustration that this nation treats packages better than children, and that the SACWA system, which is really the one technology system available to child welfare, does absolutely nothing to inform practice in the field. So we spent a couple years doing some research, and we looked to see what was being used across the country and what did people want to use. And what we found, it was pretty consistent that system after system was saying we don't have the tools that we need to be able to do what we do every day, which is to protect the lives of children. We can tell you how many kids were in foster care 2 years ago, but we can't tell you how many kids are in foster care today. And that's pretty alarming. So what we did is after we conducted this research, we gathered a group of stakeholders to hold a National Child Welfare Summit in 2007. And who we brought together were IT experts, representatives from a number of different child welfare systems, business leaders, child welfare experts, and really address this question in a couple of days of really intensive conversations. And what came from that were that we wanted to develop a system that could provide information that was cross-system information, information sharing from one agency to another, information that was driven by the family, not by the silo, and have that information available to workers in real time when they were out in the field, in families' homes, when they needed to have it. Keep doing that. From this, we formed a partnership with Stewards of Change, who simultaneously, as Daniel had described, had been on a similar journey, but coming at it from the perspective of what could business bring, as well as Microsoft and Motorola, and made a commitment to really pursue this. We selected Montgomery County, Pennsylvania, as a site for a national demonstration project, and we are working there now. You will hear more about that tomorrow, and some really very exciting pilot work that we see as the model for the country. Before I talk about the different values and the different value of doing this, I think there's 5 basic assumptions we need to make. The first is children do not live in systemic silos. We create those silos, mostly driven by funding. But children don't live there. Children live in the real world. And families don't understand the complexities that we do in terms of our alphabet of agencies and different regulations and different funding streams. So we really need to have some understanding of that. The second is that technology is a tool and only a tool. You can have the best technology in the world, but if the culture of the system, the culture of the agency, does not promote and support sharing of information, it's not going to be effective. I think we all know instances where great technology was purchased, brought in, but it's not being used. And what a waste for everyone. Again, culture change must be introduced prior to technology change. Unless the culture wants to share information, the technology is not going to be effective. The fourth thing is the voice of staff at all levels is critical. When we held our Child Welfare Summit, we didn't bring just the commissioners of child welfare agencies to the table to New York, but we brought the IT directors. We brought caseworkers who were in the field who did child abuse investigations, who visited children in foster homes, and we brought their supervisors. Each one of those constituencies has a different perspective, a different need, and is a different type of stakeholder that we thought was important to have their voice. And you're not going to have a system that's going to be effective unless you're able to have all those different perspectives at the table. And the last thing is that better information makes better decisions. Not necessarily more information. We can overwhelm people with lots of data and lots of information, but unless you have better, good quality information, it's not going to be helpful. But better information will help people make better decisions. So child welfare decision-making can be improved with the support of real-time interoperable technology. And I really, in the spirit of full disclosure, I need to let you know that I'm not a technology person. I'm a child and family therapist by training. I believe in process. I believe in talking. I believe in human contact. So I had to not be quite dragged to this, but I need to really be convinced that this was of value. I don't believe in bringing laptops to meeting with clients. But I do believe that there can be something that's better. When I first started, my first job out of graduate school was investigating child abuse reports in the Massachusetts system. Then the tools that I had were carbon paper and an IBM Selectric typewriter. And it was a really big deal that it was an IBM Selectric and it had that little ball instead of all the little key things that got caught. Remember those? I see there's a lot of my peers were nodding in the room. And when I became a supervisor in the system, how I managed my supervisor's caseloads was a file box on my desk that had 3x5 cards with the names of the families that each worker was seeing, with little dividers so I could divide up their caseloads. Those are the tools that I had. We've clearly progressed and come far, but we really haven't come all that far in the number of years that since I had that job. It's a little scary. But I still, to this day, struggle with which remote to use when I want to increase the volume of my TV. I do have a BlackBerry, and I know how to use it, but I think that's kind of, the drug of choice in this field. But I really, after seeing what happened and see what the potential was, I am now convinced that we absolutely can make a difference. The first way we can make a difference is looking at safety and risk. The primary role of a child welfare agency is to protect the lives of children, protect the safety of children. We need to have better information to make better decisions, and we need it in the field. The tools that we're talking about developing are tools that will allow workers to have access to information while they're at the field, but also to send information back in real time so that we can make better decisions. We send our workers out with little more than an anonymous allegation made about something that may or may not have happened in a home, and expect them to decide whether that child is safe to stay there that night. It's pretty scary. We all know the case of anonymous report came in that mom was leaving her 6-year-old home alone while she went to work. Imagine the worker goes out to visit and sees, fortunately, child's not home alone. Mom's boyfriend has recently moved in so he can watch the child. Great news. What she doesn't know when she went out to make the visit is that the reason boyfriend's now available is he was just let out of prison. And he was let out of prison after serving a sentence for sexually abusing a neighborhood girl. And guess what? It's not just that 6-year-old in the home. There's an 8-year-old sister as well. The picture's changed. But if you had that information, you can make a better decision. You would know that that child wasn't safe in that home at the moment. Another issue is safety of our workers. We send our staff out with little more than their personal cell phone that they may have pre-plugged in 911 to hit send in case there's an emergency. They're walking into situations where they're in danger. they have no idea what they're walking into. Can you imagine how much better it would be if they knew if the police were out the night before in a domestic violence call? If there were drugs in the home, they knew that there were drugs in the home, if they knew there were weapons in the home, if there was a dangerous animal in the home, a dog, a vicious dog, they would be safer. They would make choices, they would make decisions based on having more information. In addition to that, the technology that we're going to provide will have GPS tracking so that if a worker, God forbid, went missing, and it has happened, at least you would know where they last were. Several days ago, the Philadelphia Police Department made an announcement that they were changing the way the police department were responding to domestic violence calls. They are now going to be requiring districts to maintain databases of histories of DV calls on families, as well as being able to have information on restraining orders that were currently in effect, so that when an officer goes out on a DV call, he will know, or she will know, whether there has been a history of domestic violence calls, whether there's been a history of services to the family, whether there is a current order of protection in the home, and help to make a better decision. Our child welfare workers should have that as well. Management of cases really can benefit from this as well. Deciding what services is needed often depends on what you see within the scope of your small window. A case that a colleague of mine had many, many years ago, I think really speaks to the importance of having whatever information you're having can really gear how you're managing that case. She had gone out to investigate a report where there were allegations that a mother was bathing her children in bleach. She arrived at the door. The mother answered the door wearing nothing but a trash bag over her and said, "My clothes are in the laundry. I've got to wash everything. There are bugs all over the house." So what did my colleague think? What service would you recommend? Anyone? Psychiatric evaluation. And that's what she did. Until several weeks later, when she began to itch herself with scabies. This became a public health issue. It wasn't a mental health issue. The mom wasn't crazy. There were bugs all over her house. More information can help refine and help get you the service that the families actually need. This is what, unfortunately, our staff go through. Caseload, in terms of coordinating and decision-making on cases, is also really benefits. If service providers from different agencies are able to work together, you're going to have a better outcome. Can you imagine if there's a case manager with a developmentally disabled mother who's working very, very hard to empower this mother to be able to take control of her life, take charge of her family, while the CPS worker is going into this home separately, thinking this mother's not caring for this kid, she can't meet these kids' needs. They're working across purposes, and no one benefits from that. Can you imagine if they did know they were both working with the same family, got together and had joint case planning? Perhaps they could come up with a plan where grandma could come in as a support so that they could both agree on what was best for the family, empower mom, and protect the child at the same time. Case planning really can benefit from that. Another thing, too, that will happen is avoiding the dynamic of a family splitting. Splitting is a concept when a family will play one agency or worker against another. I think we all know that better as parents. We've seen this if you have a co-parent and children, that they will often go to one parent and shop for whatever answer they want. We recently had a experience having dinner with our 2 adult daughters. I think there was probably some wine involved in this conversation, where they confessed that they had a very strategic plan in which parent they would ask for what, depending what they wanted. I was the one who bought things, and Dad was the one who gave them permission to go places. Not surprising. But that's what they did, and it worked. It worked. They don't realize that the parenting never stops, and we now have that information. Even though they're in their 20s, we have that parked in the back of their mind. But that's splitting. And our families at times will do that as well. If you have people working together, sharing information across systems, then you will curtail some of that behavior and make your interventions more effective. Another thing is avoiding duplication of services. It's important to know, are there other agencies involved with the family? What services are they providing? What services have they provided? I think if Rick Friedman were here, he'd be able to tell you how many tests are repeated through the Medicaid system because information is not shared. Foster children who move from place to place very often start from scratch in their medical care because their records don't necessarily go with them and information doesn't go with them. What a waste of resources and what a waste of time. And why put human beings through that process? The next area is case supervision. Sharing information in real time really facilitates better supervision of cases. I know when I was a supervisor in the child welfare system, I would go out with a worker on a particularly difficult or challenging case so I could see for myself what was going on. But you could only do that in a limited number of cases. How great if a worker could take a photo or a video of a family while they're there, upload it into the case file in real time, so you could, as a supervisor in the office, with more experienced eyes, get a view of what happened. Do people recall the case of the Jackson brothers in New Jersey, where there was a report, an anonymous neighbor called that there was a little boy eating trash out of a trash can, and then they discovered that this was a 19-year-old boy whose growth was stunted? Could you imagine if when they visited that child, a picture was taken once a month and uploaded into the case file? Could you imagine the different trajectory of those children's lives? It can make a huge difference. The agency management also benefits from this. How better to document that a foster child has been visited every 30 days than when you go out to that home, taking a photo that's date and time stamped and uploaded immediately into the case record. Very simple, very easy. Much more valuable in terms of its use, as well as much better documentation than someone writing on a piece of paper saying, I did go out there, when you may or may not know if they've been out there. The other thing that you also can avoid are those, unfortunately, few but tragic cases where workers said they've been out to visit a home but didn't go. The technology we're talking about will have GPS tracking in it so that you can verify whether at least the device has been out to the home, when they've been there, when they haven't been there. Additionally, another way to use the device in terms of management is there are cases where a worker will go out to see a family, new report over and over again, they can never catch the family home. And then when you talk to them about where they've gone, they've been going every Tuesday at 2 o'clock on their way to visit Susie Smith in her foster home down the street at 3. With this technology, you can track when attempts have been made so that, maybe you should try this family at 8:30 in the morning. It might be a better time to reach them. Helps with supervision, helps with management, helps with resources. The other thing is a better utilization of your staff time. Through our work in Montgomery County, we've documented the extreme amount of time that workers spent doing paperwork, and it's not atypical of what's found nationally. If we're able to use technology to provide support, to pre-populate forms, to do a lot of this duplicative effort, our staff can do what they need to do, which is spend more time with families. The last thing that I want to speak to is the recruitment and retention of the workforce. Today's workforce, text is a verb, not a noun, from when I grew up. Today's workforce grew up using technology, and they expect to have it. If we can provide technology to our workers, to our staff, that's an incentive for them to come to work, to stay at work, to work in a professional environment. A wonderful example of this is when we held our Child Welfare Summit in New York, and Marty Lesko from Motorola was there and passed around some sample devices that he had, handheld devices. And those of us on the later end of life would look and say, interesting, until my graduate student came to my graduate student. And we all sat there in awe watching this young woman in her 20s just eat this thing up. She was enthralled, engaged. In fact, she actually got a job offer from one of the technology companies after that. And I had this epiphany. We're not the workforce. They are. We grew up having to learn technology, to be able to embrace it, to incorporate it into our work life. They grew up weaned on this stuff. We need to provide this to them, and what a wonderful way to be able to help our workforce. Well, welcome to 2010, and as we look toward implementing the first interoperable real-time program in child welfare, we look forward to revolutionizing how the system works. I look forward to treating our children better than our packages, offering our staff the support that they deserve, and not having child welfare as the last bastion of progress. Thanks.